My name is Catherine Grinnan, and I'm here with my colleagues, Nurse Jennifer Thomas and Nadine Daley. And we're from the Old Harbour's Bay Community Center of Excellence Allied Care School. Today, we gather to address a topic of paramount importance in public health, understanding HIV and AIDS. As we know, HIV, or human immunodeficiency virus, is a virus that attacks the body's immune system, specifically targeting the CD4 cells, also known as the T cells. These cells play a crucial role in defending our bodies against infections by signaling the immune system to destroy harmful invaders like viruses and bacteria. Over time, HIV can destroy so many of these cells that the body becomes unable to fight off infections and disease. AIDS, or acquired immunodeficiency syndrome, represents the most advanced stage of HIV infection. This occurs when the immune system has been severely compromised. Individuals with AIDS are particularly vulnerable to opportunistic infections, those that strike more frequently or are with greater severity in people with weakened immune systems. There are also an increased risk of certain cancers that rarely affect those with healthy immune systems. Understanding how HIV is transmitted is critical for prevention. HIV is spread through specific activities that involve the exchange of bodily fluids, such as blood, semen, preseminal fluid, rectal fluids, vaginal fluids, and breast milk. The most common modes of transmission include unprotected sexual contact, sharing needles or syringes, mother-to-child transmission during pregnancy, childbirth or breastfeeding, and, though rare, through blood transfusions and organ transplants in countries where blood is not adequately screened. It is important to dispel misconceptions about HIV transmission. HIV cannot be transmitted through casual contact like hugging or shaking hands, nor is it spread through saliva, sweat, tears, or urine. Additionally, sharing dishes, toilet seats, or being bitten by mosquitoes does not transmit HIV. Preventing HIV involves a combination of strategies that reduce exposure to risk. Safe sexual practices, such as using a condom correctly and consistently, and limiting the number of sexual partners, are essential. Regular testing to know your HIV status, along with medical interventions like pre-exposure prophylaxis, PrEP, and post-exposure prophylaxis, PEP, are critical components in HIV prevention. For those at risk, avoiding the sharing of needles is vital. For expectant mothers living with HIV, antiretroviral therapy during pregnancy can reduce the risk of transmission to the baby. Safe feeding practices may be necessary to prevent transmission through breast milk. Education and awareness are also key. Public health campaigns in the form of workshops and workplace seminars play an essential role in increasing awareness about HIV and its prevention, while efforts to reduce stigma encourage individuals to seek testing and treatment without fear. While there's currently no cure for HIV, effective management allows individuals to lead healthy lives. Antiretroviral therapy, or ART, is a combination of medications that suppresses the viral load in the body, but adherence to the treatment regimen is crucial to prevent drug resistance. Regular medical care, including monitoring CD4 counts and viral load, as well as early detection and treatment of opportunistic infections, are essential. Healthy lifestyle choices such as a balanced diet, regular exercise support the immune system, while mental health support through counseling and support groups play a vital role in overall well-being. The concept of undetectable equal untransmittable, the U equal U, is a powerful message. Achieving an undetectable viral load means individuals do not transmit the virus sexually, significantly reducing the spread of HIV. In conclusion, knowledge about HIV and AIDS empowers us all to take proactive steps in prevention and management. By practicing safe behaviors, utilizing medical interventions, and showing compassion and care, we can mitigate the global impact of HIV and AIDS. Now, shifting our focus to workplace safety concerning HIV and AIDS, it is crucial that workplaces ensure safe working conditions, particularly in environments where employees may be at risk of exposure. Firstly, identifying risk is essential. This involves acting tasks and roles where employees might encounter HIV, such as handling needles, blood, or bodily fluids. High-risk roles like healthcare workers, first responders, and lab technicians should be given special attention. Infection control measures must be rigorously assessed. Universal precautions such as the use of personal protective equipment, PPE, like gloves, masks, and gowns, should be in place and consistently applied. It's also important to ensure that PPE is readily available, properly stored, and in good condition for all employees, particularly those in high-risk roles. Workplace hygiene and sanitation are non-negotiable. Hand hygiene facilities, including hand washing stations, soap, water, and alcohol-based sanitizers should be easily accessible. Cleaning protocols, especially for areas exposed to blood or bodily fluids, must align with health and safety guidelines. Proper waste management, particularly the disposal of biohazard waste like used needles, is crucial to prevent accidental exposure. Emergency preparedness is another key area. Workplace must have clear protocols for responding to accidental exposure to HIV, including immediate first aid, reporting procedures, and access to post-exposure prophylaxis, PEP medication or drug. Training employees on these emergency procedures ensures they know how to respond effectively in the case of exposure. A thorough policy review is also necessary. Workplace policies should explicitly prohibit discrimination against employees with HIV/AIDS, fostering a supportive environment that offers necessary accommodations and access to healthcare and counseling services. Training and awareness programs should be regularly conducted to educate employees about HIV and AIDS, focusing on prevention, transmission, and reducing stigma. Ensuring that employees are aware of the workplace policies related to HIV and AIDS is equally important. Confidentiality and privacy must be strictly maintained. Compliance and legal standards is the foundation of safe workplace. Workplaces must review and adhere to local and national regulations regarding HIV, AIDS, and workplace safety. Ensuring that all safety measures meet or exceed these standards. By systematically evaluating these aspects, we can ensure that workplaces provide safe conditions, particularly concerning HIV and AIDS, while fostering a supportive and informed environment for all employees. I'll hand you over to Nurse Thomas.
Compliance with infection control policies. Standard precautions such as wearing of gloves, gown, mask, eye protection, to reduce the risk of exposure to blood and body fluids should be consistently taken. Hand hygiene. Proper hand hygiene is one of the most effective ways to prevent the spread of infections, including HIV. Hands should be thoroughly washed before and after contact, even if gloves were worn. Needle stick injury prevention. Policies often include specific protocols for handling and disposing of needles and other sharp instruments. Compliance with the procedure, reducing the risk of needle stick injuries, a primary route to occupational HIV transmission. Or exposure prophylaxis PEP. Everyone should be familiar with the step to take if they are exposed to HIV at work, including the immediate reporting of the incident and accessing PEP, which should be started in hours of exposure. Confidentiality. Compliance with confidentiality policy is critical. Patient privacy and confidentially concern HIV status must be monitored, ensuring that sensitive information is only shared with authorized individuals. Education and training. Ongoing education and training on HIV/AIDS and infection control practices are essential for keeping people updated on the latest guidelines and practices. This training helps to ensure that all staff are aware of and adhere to the policies. Vaccination and immunization. While there is no vaccine for HIV, compliance with other vaccination recommendations like hepatitis B is important for overall infection control. Use of personal protective equipment, PPE. Ensure that the correct PPE is available and used properly according to the guideline is a fundamental aspect of compliance. Regular audits and monitoring. Regular audits and monitoring of practice to ensure adherence to the infection control policies. This may include inspection of equipment, observation of practice, and review of incident report. Personal risk reduction plans. Education and awareness. Stay informed, keep updated with the latest guidelines and best practice for preventing HIV transmission. Understanding transmission. Be knowledgeable about how HIV is transmitted. Personal protective equipment, PPE. Consistent use. Where appropriate, PPE, such as gloves, gowns, masks, and eye protection when exposed to blood or bodily fluids. Proper fit and disposal. Ensure PPE fits correctly and dispose in a designated disposal area after use. Safe handling of sharp objects. Use of safety device. Utilize needles and other sharp objects that are equipped with safety features to prevent injuries. Immediate disposal. Dispose of used sharp objects immediately in a counterproof label sharp objects container Post-exposure prophylaxis, awareness of protocols. Know the procedures for assessing PEP. If exposed to potential infectious materials, timely action, seek PEP within 72 hours of potential exposure and follow through with the full course. Vaccination and general health. Hepatitis B vaccine. Ensure you are vaccinated against hepatitis B, which can be co-transmitted. Overall health. Maintain a healthy lifestyle to bolster your immune system. Adhere to protocols. Follow safety and infection control protocols in the workplace. Report hazard. Advocate for a safe working environment and report any hazards or unsafe practice. Routine testing. Participate in regular HIV testing as recommended by occupational health guidelines. Follow up. Adhere to follow-up testing and care protocols if an exposure incident occurred. Safe practice in personal life. Safe sex practice. Use condoms and consider pre-exposure prophylaxis PrEP if at high risk. Avoid sharing of needles. Do not share needles or other injection equipments.
Role in prevention and control of HIV/AIDS. First, we must assess the current situation within our organization. Understanding the knowledge, attitude, and practices related to HIV and AIDS is the first step. Identifying any gaps in awareness, stigma, or support systems will allow us to set clear goals. Whether it's reducing the incidence of HIV, increasing awareness, promoting regular testing, or reducing stigma, these objectives will allow the foundation of our program. We will develop a comprehensive workplace policy on HIV and AIDS. This policy will reflect our commitment to prevention and control. It will include non-discrimination clauses, ensure the confidentiality of health information, and guarantee access to treatment for those who need it. Defining these roles and responsibilities within our organization, it is equally important. Education and training are critical components of strategy. We will implement ongoing awareness program to educate all employees about HIV prevention, transmission, and treatment. Workshops, seminars, and education material will be readily available. Our healthcare provider will receive specialized training to conduct HIV testing and counseling and to provide compassionate care and support to employees living with HIV. We will promote regular HIV testing by providing voluntary counseling and testing services, either free or subsidized, to our facilities or in partnership with local health organizations. Creating a supportive environment is vital to the success of our efforts. Creating a supportive environment is vital to the success of our efforts. We will implement campaigns to reduce stigma and discrimination against individuals living with HIV. Confidentiality is the key. We will establish systems where employees can seek advice and assistance without fear of discrimination or breach of privacy. To ensure our initiatives are effective, we will monitor and evaluate our progress regularly. Feedback from employees and stakeholders will allow us to refine our approach and ensure it remains relevant and impactful. Our responsibility extends beyond the workplace. We will engage with local health organizations, NGOs, and government bodies to enhance the reach and effectiveness of our HIV prevention and control efforts. Community outreach will be a priority, particularly in areas where our workforce resides. Finally, sustainability is crucial. We will ensure a long-term commitment to the prevention and control of HIV and AIDS by allocating the necessary resources, continuous training, and regular policies updates. Encourage active participation from employees at all levels will sustain the momentum of our HIV program. By taking these steps, we can play a significant role in the prevention and control of HIV and AIDS, creating a safer, healthier workplace and contributing positivity to our broader community.
This is Nurse Nadine Daley, and she'll be demonstrating the hand washing technique. Proper hand washing is one of the simplest and most effective ways to prevent the spread of germs and illnesses. Here's how we can ensure we do it correctly. Step 1. Wet your hands. Begin by turning on the tap and wetting your hands with clean running water. Apply enough soap to cover all hand surfaces. Lather your hands. Rub your hands together to create a lather, ensuring the soap covers all hand surfaces, paying special attention to the backs of your hands, between your fingers, under your nails, your thumbs, and at least 2 inches above your wrist. Scrub for at least 20 seconds. Continue to scrub all surface of your hand for at least 20 seconds. If you need a timer, hum to the tune Happy Birthday twice. Step 4. Rinse your hands. Rinse your hands thoroughly under clean running water to remove all the soap. Step 5. Dry your hands. Dry your hands with a clean towel or paper towel. If you're in a public restroom, use a disposable paper towel to avoid cross-contamination. Use the towel to turn off the faucet and open the door. Step 6. Dispose of the paper towels properly. Dispose of the used paper towels in the trash and maintain cleanliness and hygiene. Remember, wash your hands regularly, especially before eating, after using the restroom, after coughing or sneezing, and whenever your hands are visibly dirty. If soap and water are not available, use an alcohol-based hand sanitizer with at least 60% alcohol. By following these steps, we can effectively reduce the spread of germs, protecting our health and the health of those around us. In conclusion, together, by focusing on HIV and AIDS prevention and practicing proper hand hygiene, we can create a healthier, safer environment for everyone. Let us all commit to these practices, not just today, but every day, to safeguard our well-being and that of our community.